For generations, the American dream promised a simple equation. Work hard, and you could afford a home, support a family, and live comfortably. But today, that dream is becoming increasingly out of reach. Today, it's harder than ever to make ends meet for most Americans. Younger generations struggle to pay bills as inflation keeps rising. They struggle to save money and get ahead, much less to buy a house and save enough for retirement. The data shows that each American generation has it harder than their parents and grandparents. In fact, the numbers tell a stark story. In 1950, the median home price was twice the average annual income, meaning that a home cost roughly 2 years of your salary. The median price at that time was $11,900, which is $152,700 in today's dollars, after adjusting for inflation. So, if we just adjust for inflation, we might expect a house to cost about $153,000 today, but it doesn't. Today, the median sale price for existing homes is around $406,000, nearly 7 times the median income. And for new homes, the average sales price is even higher, about $485,000. When we adjust for inflation, the story becomes even clearer. Inflation in the U.S. is measured as the annual change in prices for a basket of goods. It's known as the Consumer Price Index, and it shows that prices go up every year, rising between 1% and 12% each year since 1960. Cumulative inflation adds and compounds those price increases over time. Now it's even clearer. From 1960 until 2023, prices went up more than 920%. But what does that really mean for the value of a dollar over time? The dollar has lost most of its buying power over the years. If we look at the value of $1, starting in 1960, the trend becomes clear. By 1977, one US dollar had lost half of its buying power. You could only buy half as much stuff with a dollar in 1977 as you could in 1960. By 2023, that same dollar had lost more than 90% of its buying power. It was only worth 9 cents. Inflation destroys the value of each dollar. But even these official inflation charts obscure the fact that many of the most expensive things that we buy have actually gone up in price by much, much more. Since 1970, for example, housing costs have risen 118% above inflation. College tuition has increased 180% above inflation, and healthcare costs have soared 628% above inflation. Housing costs have gone up so much that many first-time homebuyers have been locked out of the market. First-time homebuyers made up only 32% of homebuyers in 2023, down from the historical norm of 40%, which is the lowest since tracking began. More people are renting, and their rent cost is taking up more of their income than ever before. Between 2015 and 2022, the number of renter households paying more than 50% of their income on rent increased by over 12.6%, exacerbating housing instability. The housing crisis means that U.S. homelessness is on the rise. In 2023, the number of homeless people in the U.S. jumped from the year before by 12%. The next year, in 2024, it jumped again by another 18%. Education costs have also soared. After adjusting for inflation, the average tuition and fees at public four-year institutions have increased by 158% over the past 30 years, far outpacing both wage growth and overall inflation. Higher education, once a reliable path to middle-class stability, now often leads to significant debt. The average student loan debt among American college graduates has more than doubled since 2007. Healthcare costs have become particularly burdensome. Every year, healthcare insurance premiums plus out-of-pocket expenses have gone up for most Americans. In 2004, the average total health expense was about $4,500 per person. By 2023, it had grown to about $10,000, more than doubling in the last 20 years. All of this while healthcare outcomes in the United States are relatively poor. Of the top 15 rich countries, the U.S. ranks worst in life expectancy at 77 years. It has the worst infant mortality rate, with more than 5 out of every 1,000 babies dying within the first year of life. The U.S. also has the highest number of preventable deaths out of the peer group, despite spending more on healthcare as a percent of GDP than any other country. What about wages and income? Income in the United States has not kept up with inflation, much less with the true cost increases of all of the biggest ticket items that Americans pay for. In fact, compensation hasn't kept up with productivity either. Productivity is the amount of output per hour per worker. From 1979 to 2024, productivity grew 81%, while compensation only grew 29%. Companies benefited, while workers have languished. The average productivity growth each year since 1979 was 1.4%, while compensation only grew 0.6% a year, much less than the average inflation rate of 3.3% in that same time. Workers have been left behind while companies benefited from the economic gains of their labor. So what has been the effect of all of these cost increases? Incomes have not kept up with costs. Most Americans are riddled with debt. More than half of all Americans now rely on welfare benefits at some point in their lives. Food stamps, temporary assistance, supplemental income, Medicaid. The number of Americans on food stamps has risen from just over 8% of the population in 2004 to 12.6% in 2023. According to the Federal Reserve's 2023 report, 40% of Americans would struggle to cover an unexpected $400 expense without borrowing or selling something. 46% of millennials and 32% of Gen Z adults hold more credit card debt than emergency savings. And about 1 in 3 Americans between the ages of 18 and 34 now lives with their parents. The middle class, which once made up 61% of Americans, has shrunk to 51%. Clearly, it's time for something new. As a society, what can we do to improve housing affordability and homelessness? Cities that have reformed zoning laws to allow more dense housing development have seen prices stabilize. Cities that have implemented comprehensive zoning reform have seen up to 23% more housing construction and an average 5 to 7% reduction in housing costs within the first 3 years. Minneapolis, which eliminated single-family zoning in 2019 and worked to increase affordable housing, has seen housing costs moderate. In addition to zoning reforms and affordable housing initiatives, research suggests that increasing housing supply through mixed density development could reduce housing costs by up to 25 to 30% in many urban areas within a decade. Los Angeles increased investments in transit infrastructure and reformed zoning policies to encourage new housing construction, including affordable units, leading to a 23% decrease in veteran homelessness at a time when national homelessness rose 18%. What about education costs? Are there examples inside and outside the U.S. where other systems may provide a model for improvement? Outside the U.S., Germany provides a compelling model to study, where their dual education system results in skilled workers at 1/3 the cost of a U.S. college degree with high employment rates and lower student debt. In fact, Germany's dual education system produces skilled workers at a third the cost of most U.S. four-year degrees, with 97% employment within 6 months. Within the U.S., states like Tennessee have shown that tuition-free community college programs increase workforce participation and reduce student debt. And what about healthcare reform? It's widely understood, as we've seen, that the U.S. healthcare system is expensive, with health outcomes that are worse than those of many other developed nations. What could be done to change the system, to improve both healthcare costs and outcomes? Analysis suggests that implementing a multi-payer universal healthcare system could reduce average family healthcare spending by 40 to 60% while improving health outcomes. However, there are complex trade-offs between access, cost, and quality that must be carefully navigated for healthcare system reform to be successful. Singapore has implemented a highly successful public-private hybrid multi-payer healthcare system that combines personal accountability with government cost oversight. Singapore's hybrid system achieves world-class outcomes at 4% of GDP versus 18% in the US through mandatory savings accounts and universal catastrophic coverage. Costs are lower, healthcare outcomes are better, and life expectancy is high. And Singapore is just one of the many models among developed nations which achieve better outcomes for lower costs than the United States. What about wages and workforce development programs? What can we learn from studying successful models? Communities that have invested in workforce development and small business support have seen median wages rise 15 to 20% faster than national averages. Denmark's flexicurity model created a set of labor laws that allow for both flexible hiring and firing for employers, but with robust unemployment benefits for the public, allowing employers the ability to quickly adapt to workforce needs, all while giving employees strong safety nets and economic security. What about transportation costs? Greater investment in transportation infrastructure could reduce average household transportation costs by up to $5,000 annually. Cities with robust public transit systems show consistently lower cost of living increases over time. All of these solutions require coordination across multiple levels. At the federal level, healthcare financing reform, expanded education access, and updated labor laws are key. At the state level, zoning law reform, workforce development, education cost reduction measures, and transportation solutions are needed. At the municipal and local level, streamlining building permits, expanding public transit, supporting small businesses, and creating affordable housing incentives are all key to success. These aren't just theoretical solutions. They're based on successful programs already working in communities across America and around the world. The challenge of affordability isn't insurmountable. Other developed nations have maintained more affordable costs of living through intentional policy choices. Although population trends have also contributed, Japan's housing costs have remained stable for decades through smart zoning. Germany's education system produces skilled workers without burdening them with debt. And Singapore's healthcare system is both cheaper and just as effective, if not more effective, than the United States. The American dream wasn't just about individual success. It was about building a society where prosperity was achievable for everyone willing to work for it. Restoring that dream isn't just about economics. It's about recommitting to the values that made it possible in the first place. The path to affordability requires policy change and community engagement. It requires long-term thinking and investment in our shared future. And importantly, it starts with education so that politicians, administrators, and the public you and me, know the facts and can push for the right kinds of change. As always, please support us by clicking the like button and subscribe to the channel to see more.